Now coming toward the first category, which are the salicylates. So we will discuss the aspirin, which is the prototype drug. The chemical formula for aspirin is acetyl salicylic acid. Note that other NSAIDs are reversible inhibitors of the COX, but aspirin is irreversible inhibitor of the cyclooxygenase enzyme. Now we will discuss the pharmacological actions. Note that these pharmacological actions are not only related to aspirin, but these are also of the other NSAIDs. Those which are specially related to aspirins will be mentioned. The first one is the analgesic effect. So aspirins basically the prostaglandins are responsible for the sensitization of the nerve for pain, means they increases the pain sensations. So as the aspirin and other NSAID block the formation of the prostaglandins, so they will decrease the sensitization of the nerve for the pain and less pain will be pursued by the patient. It also acts on the subcortical level to increase the pain threshold. The aspirin in high doses like 2 to 3 grams per day is used as analgesic. The next one is the antipyretic effect. As we know that in the hypothalamus we have a temperature set point or thermostat which maintains our body temperature at 37 degrees centigrade. But in case of inflammations, we have large amount of prostaglandins produced, so it disturbs the set point and the set point is elevated, so our body temperature becomes increased. So when we give NSAID to such patients, these will decrease the prostaglandin synthesis by inhibition of the cyclooxygenase enzyme, so will decrease the temperature set point to the normal level. Whenever these NSAIDs are given to the normal patients, they don't affect the normal body temperature. And this is an MCQ point. The next effect is anti-inflammatory effect. So as we know that in the inflammation we have increased synthesis of the interleukins, TNF and prostaglandins, which are responsible for the cardinal signs of inflammation like the pain, like the swelling, like the loss of function and redness. So for the symptomatic relief, when we give NSAIDs by inhibiting the formation of these substances, they will give relief to the patient. Aspirin is given in very high doses like 4 to 6 grams per day for the anti-inflammatory effect. The fourth one is the antiplatelet or antithrombotic effect, which is especially related to the aspirin. We know that thromboxane A2 has a function of platelet aggregation, and prostacyclin or PGI2 has a function of platelet aggregation inhibition, means it will inhibit the platelet aggregation. So when we give the patient a low dose of aspirin like 325 mg, this is also known as baby aspirin. So it will only inhibit the formation of the thromboxane A2. So it will decrease the platelet aggregation. So it has antiplatelet effect in low doses. But when we give the aspirin at higher doses like 2 to 3 grams, then it will cause the inhibition of both thromboxane A2 and prostacyclin. So there will be no antiplatelet effect because the effects are counteracted. Note that the aspirin is an irreversible inhibitor of the COX. So this antiplatelet effect lasts only for 10 days. And why it happens so? Because the platelet's life is only 10 days. After 10 days the platelets are destroyed, so the effect of aspirin is also gone.